inviting me. Thank you for inviting me to this wonderful workshop. I think it's very important for all of us to share what our organizations are going through in their efforts to provide adequate and efficient emergency responses. So I will share my screen and go over what our organization has done in the past year and a half since full-scale invasion of Russia in Ukraine. And this is a very challenging and difficult situation, as you may imagine, because every day we have different types of needs and we have to respond quickly and with efficiency. So a couple of words why our organization in particular has grown so much in providing medical aid specifically to Ukraine, and also where the roots of our organization is. So just a few words about United Help Ukraine. We started in 2014 as a grassroots organization. We were volunteer-based up until 2022, so it's been almost 9 years of our existence. We dedicate our efforts to providing humanitarian, medical, and other type of aid to Ukraine, including psychological assistance, which we will discuss as part of medical program. And we just want to provide people of Ukraine with everything they need to be able to survive in the face of adversity. And of course, defend their sovereignty and live in a free country. In the past year alone, in 2022, since the full-scale invasion, our organization deployed over $45.5 million to Ukraine in the form of medical supplies, tactical medicine, and humanitarian aid. Almost 16 million was spent alone on medical equipment and supplies that were delivered to the hospitals and other medical institutions and establishments in Ukraine. We also focus heavily, and this is also part of the medical program, on tactical medicine or combat medicine. And when you have a war, an ongoing war with a really severe battles, and we see a lot of wounded on the battlefield, this part is one of the most important to provide critical care immediately in combat. So we increase survival of wounded that are delivered to the stabilization points and then further to medical establishments and medical hospitals. So our medical aid provides everything from ventilators to wound bags to supplies to over 40 hospitals across 12 regions in Ukraine. So we pretty much cover every single hospital, and we focus on emergency care, anesthesiology, surgery, trauma, and burns as an emergency response to ongoing war. We've picked those for us as a priority at the moment because we're again trying to efficiently and effectively save as many lives as possible in Ukraine. How we work is we have a great network of heads of the hospitals that we communicate directly with. We don't send containers, although we do receive containers from our donors full of medical supplies and equipment. However, we have efficient platforms where we communicate with specific needs of each hospital. They receive accordingly, and they are not burdened with just massive amount aid that is not necessary for any specific hospitals. So we focus on procurement, as I said, specifically what's needed. We also collect a lot of donations of medical equipment and supplies. One of the examples is that we've received already over $6 million in ventilators, right? So this is something that absolutely critical for anesthesiology and intensive care units. State of Maryland kindly donated over 400 ventilators to different clinics in Ukraine, and that's worth over $6 million. We provide storage in our several warehouses in Ukraine, and we distribute countrywide. We communicate in real time, and we focus on frontline hospitals and those hospitals that are really accept many evacuated patients. Unfortunately, to be honest, the situation is not getting any better. It's actually getting worse. There are hundreds of patients that are delivered, wounded, delivered to the hospitals across country, and especially in the east part where the closer to the front lines. Besides providing medical supplies and equipment to the hospitals, we also assist in medical evacuation. I think that's, again, a priority for us. We've delivered over 300 evacuation vehicles, including fully equipped ambulances. We also provide equipment for smaller vehicles and larger, such as ventilators, defibrillators, anything portable that can fit in the car, as you can see, in the vehicle, as you can see here. We provide to make sure patients and wounded are evacuated from the battlefield adequately, and they can sustain the transportation. Another project that is under our medical aid is emergency response for mass casualty events. We called it Project 22, and we focus on 22 clinics that we identified as potential clinics that can receive at once over 100 patients in a couple of hours. We saw this with Kramatorsk when the train station was bombed, that some of the clinics in Ukraine are not adequately supplied with what's needed to maintain patients without extra supplies coming in. So we focus on this project to educate managing personnel, medical personnel, how to triage, how to respond to this emergency when there is a mass casualty event, such as bombing of a center, a shopping center, a shopping mall, or train station, etc. And we provide everything for them to maintain patients and monitor. We also monitor the usage of supplies to understand the dynamics of how this aid is delivered and how the treatment proceeds. So part of all of our initiatives, including tactical medicine, this mass casualty events response, and others, part of it is training. So we train medical personnel and managing personnel. And also, of course, for tactical medicine, we train soldiers and paramedics how to properly use equipment and how to provide first aid or treatment in the most efficient way. We also have equipped mobile outpatient clinics in Kharkiv region. As you know, Kharkiv region was occupied and then was liberated. And when we saw the devastation after Russian forces were pushed out, is that in the occupied territories, we see severely damaged infrastructure, damage in the hospital, looting. Hospitals were pretty much stripped of everything. So we have mobile clinics that go around and serve small towns, usually it's 3 to 4, and provide full range of ambulatory services. We cooperate with an organization called Frida, and we provide everything they need to provide adequate care, first aid care or primary care to people on the occupied territories who have not seen medical aid in months. So just in general, what we also do in partnership and with different organizations, for example, with organizations such as Rotary, we equipped one entire operating room in Kharkiv because there was a need. We also, together with Rotary, we provided surgical tables and lamps to the hospitals in Kryvyi Rih. We procured C-arm X-ray for a hospital in Kiev, and we also responded to a problem that was last year in Ukraine, where Russians were targeting infrastructure, and most of Ukraine was without power. As you may know, it's critical to have generators in hospitals and medical facilities. So we focused way before it started. So last summer, we focused on procuring generators for the fall and winter to make sure hospitals have everything to survive, for patients to survive. We also provided anesthesia machines and other equipment that's important to save lives and help patients heal better and faster. At the present time, we have worked with MedWish, and we had almost 3 containers now already. Well, 2 received, that's the donation, 1 on the way to Ukraine. We have 2 containers with supplies from Oklahoma Rotary Club. So I'm just showing you here that what we do, we don't do it alone. So we have partners globally, and especially, of course, in the United States. they donate medical equipment and supplies. We receive it, we take care of the logistics, and once it gets to Ukraine, we distribute it accordingly because we have a great network of medical facilities and medical personnel who is in charge of telling us exactly what's needed. So I think it's very important to stress out that what's really working is not just sending anything that is left here in the US that's not needed. No, it's actually the opposite. We make sure what we're sending to Ukraine is what is critically needed and nothing else. We've just some financial data from 2022. We've received a donation again of syringes in the sum of over $3 million that we gave directly to Ministry of Health for distribution. And as I said, we also have several medical equipment that was delivered to Kharkiv, Odessa, and other supplies, totaling over close to $60 million. And these are just quick, again, just to show that in the war that's ongoing, the needs are not decreasing, but the opposite, the needs are increasing, and we're responding. So only in the first quarter of this year, 2023, we've provided close to $1 million in tactical medicine, first aid kits, and components for paramedics. Evacuation vehicles, medical equipment and supplies, $0.65 million. Aid to hospital, $1.65 million. And that's only in the first quarter of this year. So you can see how massive the response is. And we're not the only organization who provides medical aid to Ukraine, but unfortunately the needs are only growing. So with this, I would like to stop and just also tell you that besides medical and physical rehabilitation that patients are undergoing and wounded are undergoing, we are also focusing on psychological rehabilitation and have several programs now that are expanding to provide psychological assistance to families, to children with post-war traumas. And we're hoping to expand to those soldiers who will come back from the front lines. And we're hoping to grow this program because we understand that the needs are only growing. So with this, thank you for your attention. I'll take any questions now or later when we are in informal break rooms. Thank you.
Thank you, Marina, for your presentation. Very comprehensive presentation of all what you've been doing. Very impressive, and it's a lot of lessons learned there and experience. So I will open the floor for. I mean, I had a few questions myself, but I will give priority to the participants. If there are any questions from participants, I would like to. Have some more clarification information from any of you. Otherwise, I had also because when you were mentioning the procurement, I was wondering, do you do the procurement locally, or how is the procurement done? Is it done in US or in Ukraine, or?
Both, and it's done also globally. So we find a lot of procurement is done in the US, of course, because the prices are cheaper, and we have a really quick and efficient way logistically delivering containers of medical aid to Ukraine. But we also look into some of the medical providers and providers of medical equipment in Ukraine. So if they have there what we need, we do procure. We also procure in Europe. We find the best deals, we find the best price, we communicate, and we find what's needed and deliver it quickly. So we look globally, not just, we definitely want to buy more in Ukraine. Again, it's helping the economy. We provide training and knowledge to doctors, again, helping them increase their capacity, because we understand doctors right now, it's been almost 500 days of war, and doctors have not taken a break once. Most of them are working around the clock, helping wounded that are delivered again every day. And they're pretty much at the level of burnout, a very severe burnout. So we're trying to figure out how to provide them knowledge and increase their capacity so they're more efficient, and we find ways to do that.
Okay, thank you for the clarification. I don't know if there are more questions from participants. I don't see any hands.
Beatrice Safer wants to ask a question.
Yes, please.
Thank you very much, Marina, for the incredible, amazing work. I actually have a couple of questions, but they're both about collaboration. I noticed that one of the partnerships you mentioned was SAMS, and I was wondering if this is the Syrian American Medical Association, and if so, how would you describe the added value of having partnership with another diaspora-led organization in the States? And my other question is, is there any kind of relationship or collaboration with a Red Cross or Red Crescent National Society, so the American or the Ukrainian, if you have any experience with that?
Thank you, Zafar. Great questions, and thank you for bringing out SAMS. Yes, you're correct. This is Syrian American Medical Society that we collaborated with on Project 22. They've been in Ukraine helping since day one of full-scale invasion, and they actually approached us, and we simultaneously came to the same partner in Ukraine. And we formed the collaboration between Ukrainian Revival Institute that is providing boots on the ground. We have SAMS and United Health Ukraine working from the US part on procuring items, on funding training sessions, funding in-person workshops. We fund Zoom meetings for coordinators. It has been an absolutely wonderful experience working with SAMS and collaborating, because each group, we have 3 or more sometimes when we have also people who participate in training. So every group brings their knowledge and their experience and expertise to the table. And with SAMS, for example, because they've been working in Syria for so long, and they understand the situation, how it evolves on the ground when you have mass casualty events, it was very valuable for us to learn from them. And from our part, because we have a good network of hospitals and we have good logistics and procurement, so we took care of that part while also funding the training. So basically, it's a mutual collaboration, mutual responsibility that really is synergetic. So we're just adding the value to this project by bringing more partners to that. With Red Cross, we have not worked yet. Unfortunately, it's a big organization. It's too slow often because it's so large to respond to immediate needs. For example, we had a situation with Kakhovka Dam that was blown up by Russians when you had severe flooding and people needed aid. Our organization started packing the same day. The aid was delivered the next day to the region. And some larger organizations, it takes time for them to respond. So we haven't worked with Red Cross yet. We probably would be interesting to learn from them or communicate with them, but no, it hasn't happened yet.
Thank you, Marina, for answering those questions. And that's actually a very nice transition. There might be some more questions later on, but it's a nice transition, actually, this collaboration you were mentioning with the Syrian Association, because it will then, I'm giving the floor now to Mohammed, that will be also explaining about the experience of Hand in Hand for Aid and Development in health and medical assistance as well, in a context as well that is as difficult as the one you've been describing. So over to you, Mohammed.
Thank you, Patricia, very much for giving me the floor for this opportunity to share hand-in-hand experience, especially after the earthquake that's been hitting south of Turkey and north of Syria in last February. So first of all, like as many of you know, that the Syria war, it's been like, for now, it's almost like 13 years of war, and also the economic collapse, almost like devastating the Syria, leaving over than 15 million people in need for humanitarian aid in Syria. Northwest Syria region, which is like bordering south of Turkey, is particularly affected with 4.5 million people, mainly women and children, trapped in the war zone. Most of them, almost half of them, they are living in the camps. For Hand in Hand for Aid and Development is one of the Diaspora Syrian NGOs that's been established back in 2011 after the start of the war in Syria. Currently, we are working almost in all the sector, but our main focus in the health, with almost like the annual budget of 20 million. As we said, as we are doing the multi-sectorial, focusing in health mainly, but also we are doing WASH and other sectors, which is somehow serving the health outcomes. Regarding the health challenge before the earthquake, the health system in North Syria was already suffering from the severe shortage in the funding, due to the lack of the funding and the fatigue, the donor fatigue after like 13 years of the war. Also, we've been suffering a lot from targeting of the health facility, and we lost many health workers. Also, we have like very somehow fragile referral system. We depend on the neighboring country, mainly Turkey, for providing some of advanced healthcare services before the earthquake. And of course, the uncertainty and it's like didn't help the humanitarian actor to anticipate the conflict trend, and somehow because of the political complexity of the Syria war. For example, that we are somehow depending on the UN cross-border resolution, so we have to wait every 6 months for the renewal, and that's keep us in somehow in short-term projects, mainly less focusing in early recovery and to find an exit strategy for example in the health. The last earthquake, of course, have like experiencing the challenging, damaging the communities. Almost like 148 communities in Northwest Syria being impacted. Almost 55 health facilities also has been damaged partially or totally. The earthquake and figures like more resulting in Syria almost like 4,500 deaths and more than 10,000 injuries, with almost like half of them is women and children and girls. Approximately 10,600 buildings were destroyed or partially damaged in North Syria, including 55 healthcare facilities. Of course, after the earthquake, like the main health intervention for Hand in Hand and other actors to focus mainly in the trauma management, especially after in the first week of the earthquake, and to increase the capacity of the hospital for trauma and the surgical hospital for capacity. Also to focus, we focus mainly in the ambulance services for referral, and also the mobile clinics to serve the impacted area, the most impacted area. Also, the main concern like was the shortage of supplies. So during the first 10 days, we've been like running after time to secure enough supplies, especially that's the Turkey has been impacted also. So we usually depending on the supplies coming from the borders from Turkey. So South Syria has been impacted. That's mean there is no supplies for the Syrians to cross to Syria. Regarding hand in hand role during the earthquake response, so we have 5 hospitals in the area of the earthquake. We contribute with other health actors in the first day response mainly for the trauma treatment cases. And also we activating the emergency team to the most affected areas, for example, through mobile clinics and through deploying more ambulances to that area to help the city defense in the response. Also, we focus in the equipping the facility, our facility mainly, and other facility, if applicable, if we have the fund with the needed supplies to prevent any shortage. For example, providing the fuel to the facility in the first days after the earthquake was very crucial, because we used to depend on the electricity coming from Turkey. But because of the earthquake, so there was a cut in the electricity, so we have to shift back to the generators. And the need for fuel was very crucial during the first days. So we deploy a lot of fuels for our facility and other facility in the north. Also, hand in hand, it's the supply chain partner for WHO. So we are responsible for facilitating the delivery of supplies to Syria through Bab al-Hawa cross-border from Turkey to Syria. So, and during the 3 months after the earthquake, so hand in hand almost succeed in delivering medical supplies of almost 60 trucks from WHO, and many others from other partners to the health facility, including Aid Pioneer, that also they deliver for containers also for Syrians. Also, as a response, we activate a lot of campaigning for response in the health and other sectors, and it's play a crucial role also in responding. It gives us like kind of more fast and dynamic movement for responding for the people. The challenging, it was mainly in the first week of like shortage in the trauma kits, and also the lack of like specialized advanced healthcare services. As I said before, that we used to depend on the Turkey border and the Hatay area for providing specialized care services. So it's being cut because of the earthquake. That's put us like in huge pressure for providing more advanced healthcare services. So this is one of the main challenging. Of course, because of the earthquake and the damage of the health facilities, so the essential health services, like for example, the sexual and reproductive health, child health, dialysis, mental health, psychological support, physical rehabilitation, prosthetic and orthopedic services, also it's been like severely interrupted because of the earthquake, and it's take like weeks, even months to recover from the impact of the earthquake. Mental health and the psychological support needs increased significantly after the earthquake, especially among the children. Hundreds of thousands of people expected to require this assistance so far, still until now. The crucial need, it was like the urgent requirements, including the essential medicine especially for the trauma kids, also communicable and non-communicable disease medicine. It was also there was a huge need. Now it's become better. We have like more supplies, but after we are talking about the first almost months after the earthquake, we face a huge need, a huge gap in this part. Also, there's rehabilitation services. If I coming to the challenging, the challenges mainly the funding situation. I think it will come back. Of course, we have a kind of peak of funding after the earthquake. Many donors approach and contribute, but we think that we will suffer again almost like at the end of the year. So that's will leave us like with the concern like for sustaining the health response in North Syria. The healthcare interruption due to the earthquake that's impact the south of Turkey also, as was one of the main challenging for the Syrian NGOs and the actors that are working in Syria. If I come to the lesson learned, I think that's it's very important to repositioning sufficient supplies to be in place in Syria for such scenario, God forbid, for the future. So, but we need to deploy enough supplies to be mobilized like as much as we needed right away after any escalation in the war or if any like national disaster happening again. Also, we need to focus more on prioritizing specialized advanced healthcare services. As I mentioned, for example, the cancer, the cardiovascular surgeries, we suffer a lot from like interrupting and closure of the border. Till now, still like the few numbers they can cross for cancer treatment. It's, you know, as you know, it's very expensive. So the NGOs, they cannot like provide this kind of services for a long time. So it's really important to do something regarding specialized health services. And of course, in the long-term plans, we need to focus on rehabilitation and replacing the damaged health facilities. Also, one of the lessons learned, like the role of advocacy in fundraising, it was crucial. It gives us like the dynamic and response very fast. Usually, you know, the institutional donor, they need sometimes to deploy, to negotiate with the government, to allocate some money. So if you have like more advocacy in doing fundraising and campaigning, it's like play a very critical role for helping and saving people. The coordination role between the actors working in the same area, you know, after the earthquake, it's become like kind of chaos. So it's again, like it's very crucial to activate and focus more in the coordination. And one of the lessons learned also, I would like to share, that's delegation to the field team. Of course, you know, that's us, we are living in Gaziantep, but we've been impacted, our family, so we cannot like do the work in appropriate way. So the delegation to the field staffs to give them like the authority to move like faster. This was like one of the good lessons learned to keep it in the future. To give, of course, it's need like work with them for their capacity to be ready for like taking decision like right away when it's needed, but it's like really helpful, and especially in the first days of the earthquake. In conclusion, like the earthquake has severely affected the already very fragile health system in northwest Syria and health response. Where humanitarian aid is the primary source for the people, almost like the only source for the healthcare for the people, for the most vulnerable population in northwest Syria. As I mentioned, half of them, they are living in the tents. Addressing the identified challenges and implementation, the lessons learned are crucial for providing sustainable and effective healthcare in the region future. So this is from my side. I'm ready for any question, and thank you very much for your listening.
Thank you so much, Mohammed, for your presentation, and again, very impressive what you've been able to do and provide in aftermath of the earthquake. I see we have a question from my colleague. Okay, sorry. It was a clap. Sorry. So yeah, and now if it's time also for questions, if any of you have some questions for Mohammed, before we move to the next section. I have one actually, because you were mentioning that at the end, the fact that your staff on the ground were affected themselves. How did that? So how did you manage to respond swiftly to the situation while you were yourself directly impacted and affected? Could you maybe give us a few words on that?
Yeah, actually, it was not easy at all. So us ourselves, like being impacted in Turkey very badly, our family, we have to take care of them, and also the field staff. So how we manage it, that's we almost like we create kind of like emergency response team in Turkey and also in Syria. So anyone who can help, so they are step in and they start doing the work in our offices in the field, and also here the staff, they can manage to do it. So also we create kind of room for coordination and contacting with the donors, with the partners, with the UN agency for facilitating all of this. It was not easy at all. So for me myself, I have to drive like with my family just to keep them safe in some place in Istanbul and come back right away to start to the work. But the experience of delegation to the field staff, I think, is like really very good. The WHO, for example, the WHO office here in Gaziantep is being closed. Most of the staff, they leave to Istanbul. So they send a message the day after the earthquake to hand in hand that we are doing the delegation for the field staff. It's okay. So we told them, of course, it's okay. So we just like inform the staff, you can move the supplies. just record everything, move the supply like right away. And the first batch of the supplies move it from the warehouses almost like after 12 hours after the earthquake. So really was helpful. This kind of delegation is needed. Even like as I mentioned, that the supplies was not enough at the first 10 days, huge shortage, but at least like we have something we can move in it. So it's really important for this support for the field staff. Again, like many, I mean, like myself, I lost my house, the old house, so I have to move to the new house. Also, many of the staff been impacted. So what we did, like we did some kind of duty of care, supporting for them. We have now a project for mental health for the staff themselves, training for the team managers, for example, all of them, they've been training how to identify any kind of need for mental health from the staff. We almost have now almost have 1,200 staff members between Syria and Turkey. So this kind of project will support them in somehow identify any kind of like support in the mental health side or sexual support side, and help the managers also to help their staff in somehow.
Okay, thank you, and very sorry to hear about your house, and also that how you've been yourself directly impacted by the situation. And it's even more impressive to see what you've been able to do. And this is a very good also example that because of a trusted relationship with a previous with another organization that you enabled, that gave you this delegation so that you could act and move the supplies so quickly after. But thank you so much for your presentation. So